The lawyers made me say what you all know anyways. This podcast does not create a doctor-patient relationship. Please listen to the short, informative disclaimer at the end of this podcast. Hey, I'm Dr. Matt Kettman. Around here, they call me Dr. Rock. Well, I wish they did, but welcome to Dr. Rock's Family Practice, where we tackle health with straight talk, big laughs, and real solutions. No fluff, no nonsense, just the tools you need to live your best life. Let's get started. How are we doing? I am here to talk with you about something that may save some lives. I'm excited. I'm Jack. This is Dr. Rock's Family Practice. I'm Dr. Matthew Kettman, trying to make an effort to get people to call me Dr. Rock, but no one is taking me up on that. Why do I call myself Dr. Rock? I don't know. It's my license plate, but I am a physician and a musician, and so I love rock and roll music. I think I started my love affair with all things hard rock probably in the mid-'80s. I can remember Van Halen's 1984, David Lee Roth jumping all over the stage, and I was like, wow. And I remember Quiet Riot, Come On, Feel the Noise. I actually got to meet that guy one day in my hard rock cover band with originals called Lotus. We're able to open up for Quiet Riot at my Waterloo days. The last song we were playing was One by Metallica, and that drum part's kind of difficult. And so you don't hear a lot of cover bands do it, and I was proud that we could. And so we finished with that, and the band, Quiet Riot, pulled up in a minivan, and they were so complimentary of that song. And then they actually needed to borrow my brother's bass equipment, which was cool. But Kevin Dubrow, who was the lead singer, he's deceased now. I really wanted to meet that guy because I remember him from the videos back when I was young, but he wouldn't. He wanted $20, even though they were borrowing my bass equipment. So I was disappointed in that, but I still love Quiet Riot. Anyways, Guns N' Roses, Appetite for Destruction, that album changed my life. That was awesome. And I kind of just petered along with hard rock. And then in college, I believe it was 91 or 92, but then Nirvana's Nevermind came out and everything changed. That same year, we had Soundgarden, my favorite singer of all time, Chris Cornell. They came out with Bad Motorfinger, and then probably one of my favorite bands of all time, Alice in Chains, came out with Dirt. Great album. So I started singing, and I had a job as a lab guy. I went to college in Marycrest at Davenport. It's closed now. But I would work in the evenings. I would be there, especially on the weekends, and I would work in the lab testing the wastewater to make sure it was quality before it was released into the Mississippi. And I would just crank them tunes, and I would just be screaming Judas Priest type stuff all night long. And over time, I was like, man, I think I can sound like these guys. Why don't I join a band? So I did. And then I learned how to play guitar because I had a lot of songs in my head, and I started writing, and I started working with other artists, and it's just been fun. So check out the videos, check out some of the music. If you buy something, all of the proceeds are going to the school that I started in Haiti, Cap Haitian. I want to say my school, but it's not my school. It's school, because we now have donors. We have a board. We got Gil Irie as a partner supporting. We've got my music, the Batman to me being Robin. He's a bigger musician pro than I am. Dave McAnally supporting it. We got Kevin Harberts supporting. So all of my friends have now become part of this school. And so literally it is our school. And so we're doing awesome things with the school. I haven't been there in years. And the reason it's been impossible to travel there because of the conditions of the country and the turmoil and the upheaval. It's just not safe. But I'm hoping in the next couple of years, we'll see how the administration change affects the ability to travel to Haiti. I'm going to get back there, and so are my fellow board members. But please support the school any way you can, prayers or even financially. If you so choose, we are a 501c3, and there's a link from my website. So support the school, Belle Avenir in Cap Haitian. So today, guys, I thought, why don't we try and save some lives? I hopefully some of the previous episodes have improved the lives or the health or are pointing you in the right direction for sure. But what about saving lives, okay? So is testosterone or dieting lectures going to save lives? No, probably not. Maybe the depression lecture I gave and having some people, that may have bipolar depression or something that are, taking the wrong medicines, maybe they'll get some help. That could be a lifesaver for sure. But I wanted to maybe save some lives. And I thought, where could this be? What can I talk about today that's cutting edge, that I've actually seen, a test that's now offered across the United States, that I do think if you use it with caution can be a lifesaver. So what am I talking about? I am talking about a CAT scan of your heart. It's called it's called a number of things, but I guess I refer to it as a coronary artery calcium screen. What is this? It is a very low dose radiation, like I think comparable to the amount of radiation in a chest x-ray as opposed to some, very radioactive CAT scan or something. It's a CAT scan, but it's a very little amount of radiation. So it's going to be a tube you lay in very quickly, a lot less time than an MRI per se. And what we are doing is we are trying to take pictures because with x-rays, things that are calcified will show up as white, where normally it's just a black background. Bones will show up as white. And so on an x-ray, you'll see bones, but you won't see, for instance, the heart or the lungs, and except a vague outline of them, plus some of the features like the blood vessels and whatnot. But there's soft tissue, and there's not the hard, the things that reflect light, or actually radiation in this case, like calcium, like bones. But it turns out when you're blocking arteries, I kind of think of it like pipes over time. As arteries clog or pipes clog, the process in the body is called atherosclerosis. And it's typically a process of injuring the vessel wall, whether it be from toxins of smoking or super high blood pressure over time, blood sugars, all these toxic things, micro injuries to the wall. And then the body sends platelets to repair, and that gets in there and it takes cholesterol and they make a kind of a repair lattice this is how I think of this current model of how we make blockage. And then that narrows the artery a little bit. So that cleanup process, it's probably a flawed. I mean, if there's any doctors out there, cardiologists, call me and correct me. That's fine. I'm just trying to explain it to the lay people the best I can off the top of my head. That starts to build up gunk, basically, that restricts the blood flow. So I'm talking about someone who's heading for a heart attack, a blocked artery. So every tissue in the body gets blood, including the heart itself, even though the heart pushes blood through its out hole, aorta, to the rest of the body. Some of that needs to come back and supply the heart itself. It can't just suck it out of the flow that's going through to the rest of the body. And so there's little arteries that shoot back into the muscle. When one of these gets blocked with this process of cholesterol and clotting over time, that turns into a calcified plaque. So as it hardens, it turns into calcium. And then what would happen is this would eventually become a 60, 70, 80% blocked area in a heart or in a brain. That would be a stroke. And eventually either the blood supply isn't enough to keep that tissue alive, or what more commonly happens is a piece will break loose and come by and float right there and get stuck right in that 70%. So you'll end up losing the health of some of the tissue that it supplies, which can be fatal. So we're talking about atherosclerosis. Well, guess what? When you scan a lot of people, not all, a lot of people with that plaque buildup, you can see calcium. And so we have figured out a way to use a low dose radiation, because it's not going to be worth it if we're giving everybody cancer with radiation. So we're using a low dose radiation to kind of determine how much calcium you have. Now, let me clarify this. That is a very indirect measurement of what we're trying to prevent, which is a heart attack, right? Or death. So just measuring someone's calcium, it's a little indirect, so it's not going to be 100% accurate like we would like. It's not like an angiogram. It's not going to give us information for $150 with no contrast and low dose. It's not going to tell us, hey, buddy, Larry, my 45-year-old patient, you've got an 80% blockage in your widowmaker. We need to do something. It doesn't do that. The only thing it can really do is say, how much calcium do you have? And then let's put that on a chart next to 100 people your age and sex. So is it the best information? No. But if it's used appropriately, it can be very valuable. This is why it's still not covered by insurance, because we're not sure what to do with it. And in medicine, just because you have a test available doesn't mean you should have the test, because unless there's a good reason to do the test, what ends up happening in most cases, if you're giving it to someone, you're going to cause false positives. False positives in medicine sometimes lead to harm. We don't want somebody having a lung biopsy for a cancer unless we're pretty sure that it could be cancer, because sometimes there's complications. People can die from procedures like that. So you really got to be very careful about who you use a screening test for. And that's a lot of trauma. So we can harm people just by testing them. So don't always assume that you need or want a test. So let's get that out of the way first. Okay. So this test can be super helpful, but you got to be the right type of patient. What do I mean? An extreme example, I don't think anybody's going to do this scan on like a 20-year-old girl. Their chances of having a heart attack anytime soon are extremely low, and anything we find is more likely to cause harm and be a false positive. So I think most people can be on board with that. Given those kind of limitations, though, where can we use it? Well, here's where I use it in my practice. I never use it for people who are having chest pain or shortness of breath. Those people need to go the standard route, finding out what's causing their chest pain or shortness of breath. This is not for those people. I'm using your man or woman who comes in and really they've got a lot of reasons why they should have blocked arteries. Okay. What we can do, like I said, I can't tell this person that you've got a 90% widowmaker or something like that. What I can do is I can say, okay, Larry, you've got brothers that had heart attacks and died at 45 and you are 45. We can certainly work on your blood pressure and cholesterol, but now I've got this test that'll show, compared to other guys your age, how much calcium you have in your heart. What does that mean? Okay, well, this is what it looks like in my practice. This man would go get this scan, okay? He would come back. If he, percentile-wise, was very high, meaning 99% or 99 guys out of 100 have less calcium in their heart than this man does that mean he's going to keel over dead and we need to immediately rush him to the cath lab? No. In fact, there's a lot of false positives, but it's very concerning, and this guy needs to go see a heart doctor. Now, I've sent a number of people with this test to the heart doctor. Some of them ended up without any symptoms getting a heart bypass and have sought me out in public and thanked me for doing that. Others have gotten a very high score, and then when the heart doctor actually went in, there wasn't a corresponding blockage. But if you are scoring super high on that calcium score, you're out of my park, you're going to the heart doctor. So I use it there. If you have a very strong family history, you don't want to sit around and wait to see if you're going to get that history by having a heart attack and dying. So if there's anything we can do to keep that from happening, it would be welcome. If you are that same person, Larry, whose brothers died at 45, I'm just making this up, but you know what I'm saying. If you score a 0, so you have less calcium on the whole score of your heart in your arteries, less than 99% of the population your age and sex. Well, guess what? That's a pretty good reassurance that you do not have your family history. That's a pretty good reassurance that you do not have critical blockage. Now, is it 100%? No. As a matter of fact, you can have what we call non-calcified soft plaque. So you can still block an artery and it doesn't show up on this test. Another reason this test is not covered, because we haven't figured out who and what to do with those people. Okay. And then probably by definition, the most common test result would be somewhere in the middle. Well, for those people, let's say you are not having symptoms. You're Larry, you're 45, your brothers died, you're here for a physical. Your brothers died at 45, you just don't want to die. If you're right in the middle, well, I'm probably not going to rush you off to the heart doctor. And I'm probably not going to tell you that you're okay, don't worry about it. We never really say that. Like I said, even in the low scores, soft plaque is still a possibility. But I'm definitely going to use that information. Look, you're starting to put some plaque down. You're 45. You definitely have this family history to think about. I don't know if this is enough plaque to indicate that you've got this from your family history, but let's start working on your lifestyle, because we know you're starting, let's say you're in the 50th percentile. We know at least half of the people your age have less than you do. So why don't we talk about lifestyle? Why don't we talk about, would a statin or a cholesterol pill, even if you have normal cholesterol in this case, where what we're trying to prevent the cholesterol from doing in the first place, making blockages, plaque, in this case, those types of medicines can help clean out those arteries. Would you like to take one, even if your cholesterol is okay? Would you like to go see a heart doctor? What can we do to make sure that this doesn't ever turn into an event. So I have started using this in my people who have a lot of reasons to think they could have a heart attack soon. When I say soon, I mean in the next 5 or 10 years. But we just don't know. I mean, I also use this test in people who have a high cholesterol, who really can't or don't want to take cholesterol pills. Okay. I get it. Not everybody can take cholesterol pills. Some people get super achy from them. I am one of those people. I want to be on a statin because I hear of all the wonderful artery cleaning benefits that they give you and can actually, in theory, reverse the aging that happens in a vessel. However, every time I take them, I get achy. And that's a lot of people. I see a ton of people in my practice who walk in as new patients. And the worst of it would be someone in a wheelchair for their arthritis. But the whole time it was actually the slow onset of a statin giving them muscle aches. I know the medical literature has said that this type of reaction to a statin is rare, like in the 2 or 3% or something. Don't quote me there, but I'm telling you, it's more like 1 in 4. I see people who have statin muscle aches all the time. And I see people who have muscle aches and joint aches from their statin that the doctor tells them it's not from the statin. And it can happen the first day you take that medicine, or it can be years later. And unfortunately, the only way to tell sometimes is to stop it, which you cannot do. Please, people, don't anybody listen to this and then stop their cholesterol pills. Talk to your doctor, because it might not be that. It might be arthritis. And if you're somebody who's working on a 99% blockage and then you abruptly take away this statin, which was working on cleaning out the arteries and was working on keeping these arteries greased, because statins do have anti-inflammatory and a little bit of blood thinning properties, which is why we think there's these mortality reductions above and beyond the cholesterol reductions. You stop that abruptly, sometimes that's a heart attack. So don't just stop medicines just because you think you heard from me that it might be your cholesterol pill that's making you super achy. Just talk to your doctor. They often have things you can do instead, like start coenzyme Q10, which can block the muscle aches of a statin. But we're getting off subject with statins. We're talking about preventing coronary artery disease, heart attacks and events, and we're talking about this coronary artery calcium screen. It typically, in our community, at our community radiology center, which are typically cheaper than hospital radiology departments because they don't have to take care of ER patients and whatnot. Ours here is $150 at ADI. It's our local advanced diagnostic imaging. It's our local community radiology center. I think some of the hospitals, it gets as high as $800. So shop around. This is something you're most likely going to have to pay cash for. But like I said, you got a family history. If someone who's been sitting around for years wondering if you're going to have a heart attack just like your whatever brother or dad did at this age. And I mean, we can't 100% confirm or deny whether that's true, but we have some tools to take some action to prevent or predict to some degree. And so I just want you to be aware of this. It has been a lifesaver. It's not for everybody. Please don't go to your doctor demanding this test and have them say, sir, I know you heard a podcast, but you are 21 or whatever. You're not going to have heart disease. If your doctor doesn't want to do the test, doesn't think you need the test, you probably don't need the test. But if you are somebody who has risks, has reasons to think that they may develop heart disease, if you think you're going to have a heart attack at 45 because your brother did, find out at 35 if you can, because 10 years of taking some of these medicines can actually help, in theory, prevent it from getting worse or turning into a problem. In theory, the guy who dies at 50 of coronary artery disease from a heart attack, in theory, if we would have got a hold of him 20 years ago, maxed out his statin, put him on aspirin, put him on lifestyle, reversal types of interventions, exercise, maybe a Mediterranean diet. Maybe we'd put them on blood thinners. Maybe we put them on a blood pressure pill. We do all these things. They quit smoking. Who knows what would have happened in 20 years? In theory, the statin could have cleaned out their artery and kept it from progressing to the point that they either died or needed a stent or a bypass. So yeah, I'm not saying it's the end-all be-all test and everybody needs it, but it is out there, and there are people whose lives, in theory, it could very well save. And I've seen it. I've seen it in my practice. I've had people that, to this day, tell me that me and them deciding to do that test was what saved their life. So I just want to make you aware of it. I don't know if you need it or not. That's a discussion, another discussion to enhance the quality of the visit that you get from your primary care physician, nurse practitioner, I am here, as always, to make you better in your health, make you better in your life, to make you better in your goals. This has been another episode with Dr. Matthew Kettman of Outside the Box Healthcare, also known as Better. Thank you guys, and keep rocking your health. We'll see you next time. The information provided on this podcast is for educational and informational purposes only. It is not intended as medical advice and should not be considered a substitute for professional medical consultation, diagnosis, or treatment. Listening to this podcast does not establish a doctor-patient relationship with me or any guest on the show. Always seek the advice of your own physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you heard on this podcast. Use this information at your own risk.